around on that and you'll understand why. I'm Shannon. I'm a surgical nurse working in the area of robotics here in Tulsa. I'm also a confessed wowhead. I'd like to give a shout out to the bronze beard server. Woo! Shameless. No, but every time I tell somebody what I do for a living, I often get asked a lot of questions. So I thought it might be a good topic, an interesting and definitely nerdy topic for the Ignite crowd tonight. This is the robot, I don't know if you can see it, it's sideways apparently, that I work with on a daily basis. And it doesn't have a name, so if you think of anything, please let me know. But what that machine does allow us to do is allows the surgeons to do some pretty miraculous things. And this here is the tower. It's part of the components of the robot. There's two other components of the robot. That is the patient cart and also the console in which the surgeon sits in. And it basically is minimally invasive surgery. In traditional surgeries, you have a larger incision. And that can create a lot of problems for people. You often have increased infection rates. You have longer healing times. With porthole incisions, it really allows for people to get back to life quicker, back to work quicker. Here you see some differences in traditional versus robotic incisions. And we do prostatectomies, we do vaginal hysterectomies, we do colon resections here in Tulsa. In Oklahoma City, we do several heart procedures, and that's really nice not to have to crack the ribs open in order to get those done. I expect that we're going to get a heart surgeon that is robotically trained within the next 12 months here in Tulsa. Here you see two of the three components. The great thing about this is really neat that it really helps if the surgeons have been trained and grew up on video games, because they look inside the console 3D. It's stereoscopic at 12 times the magnification. So it's like they kind of crawled in the body cavity at 12 times the magnification. The arm that you saw is what really allows us to do things that are miraculous. It greatly reduces the size of our instrumentation that we put into the body and allows a greater degree of control and articulation of these hand movements, even greater than the human hand. Like, you can grasp the robot console and turn it around, and if you need to, you can re-grab it and just continue. It has no limits over articulation. And to give you an idea of size, compared to regular instruments, it's like vascular surgery. It's just completely tiny. And it's beyond incision site. It's more about what the patient experiences. Take prostatectomies, for example, when we take the prostate out of someone due to prostate cancer. You not only have the prostate and urethra to connect, which is a very small tube to begin with. You have a large set of nerves that bundle around the prostate that control important things like erectile function and your bladder control. So if you don't have minute abilities to control that, you often have people come back with a lot of issues. With robotic surgery, you're seeing that minimized. A lot of guys are having normal lives after taking their prostates out. And this is important to you because eventually, if you live long enough, you will have prostate cancer. I hate to tell that to you, but get checked. In fact, Dr. Oz was here just this week, and I think he was over at Promenade or something, and they were giving free prostate. So if you know anybody over like 45, go get checked. Here's it peeling a grape. And it kind of gives you an idea of the precise movements that the robot can do. Now, this is a CyberKnife. I get asked a lot of questions about CyberKnife. And just to clarify, I don't work with CyberKnife, but just to educate you, it is not surgery, but it is a great delivery system for radiation. It's an old auto robot that they use to actually rotate around the cancer, and so that it spreads out the area that you actually have radiation on your skin, reducing that kind of secondary contact stuff you get. This is a picture of my OR. As you can sort of see, I'm not sure why some of them end up sideways, but you see the three parts. We normally work in the dark. When I first started in 2006, I was at St. John's and they had one robot. We now have robots in 4 institutions in town. In 2006, hardly any surgeries were done robotically. This year alone, we're doing 35% of hysterectomies robotically and 75% of prostatectomies robotically. Compared to last year, we're doing 4% of hysterectomies robotically. So you're gonna see a huge margin grow, and the chances that you or someone you know and love going to have a robotically assisted surgery is great and increasing every day. Now, if you have a chance, go to YouTube. These next 4 slides, I couldn't play a video, but this is really unique. And just search Da Vinci and origami, and it'll show up. But this is the Da Vinci machine actually doing some origami. And you can kind of have an idea of precise movements and exactly how minute everything is. And if you were ever to be cut on and you do have the choice to do it robotically, check your surgeons out. Make sure they've been properly trained and have a lot of experience, but this is the way to go. Thank you very much.